Bismillahirrahmanirrahim. Assalamu alaikum, dear all participants and SESME members. Very warm welcome to webinar arranged by Saudi Society for Medical Education Riyadh office. I'm Dr. Shazia Iqbal, chairperson and head for continued professional development activities at Saudi Arabia, Riyadh office. In medical education, assessment has a powerful position steering effect on learning and curriculum itself, and the use of portfolio is one of the form of assessment. E-portfolios are considered an alternative and objective tool for student assessments in competency-based education, and e-portfolios are being adopted by various medical schools, and definitely they help us to enhance and assess students' abilities, especially attitude, professionalism, critical thinking, and leadership abilities. Currently, medical schools are developing a system for e-portfolios and encouraging medical students to use e-portfolios to be successfully established as an assessment tool. Therefore, medical educators and faculty members, they must have training that how to develop e-portfolios, and there should be a way to know the perspectives of medical educators and student compliant about e-portfolios. This webinar will offer an insight into e-portfolios in health professional education, and I'm very much honored and delighted to present our distinguished speaker, Dr. Zareen Siddiqui. Very warm welcome, Dr. Zareen, to SESME Webinar Riyadh office. Dr. Zareen Siddiqui is consultant psychiatrist with PhD in medical education from University of Western Australia. She is currently leading medical school at Vinh University in Vietnam as MD program director. She served an associate professor at University of Western Australia for long years, 16-year experience, and she had a leading role in assessment and feedback processes within Faculty of Health and Medical Sciences. She had an active role as a coordinator for planning, development, and implementation of MD portfolios. She had led several e-portfolio initiatives in various institutions, besides creative approach to learning and assessment. And this is a great time that we can learn from her experiences and reflections. Very warm welcome, Dr. Zareen, to Riyadh office. And I shall be moderating this session. Very warm welcome to all participants. So first there will be presentation, and later on we shall take questions from all participants. So feel free to write in chat box or raise your hand by end of this webinar. So over to you, Dr. Zareen Siddiqui.
Thank you very much. Assalamu alaikum. Good evening, good morning, wherever you are. So first of all, thank you very much for the Saudi Society of Medical Education to allow me to talk to you all. And thanks, Shazia, personally. We have known each other for now a number of years. But again, thank you very much. Shukran. I may not speak for 50 minutes. I'm one of those people who love to listen. So if participants will be sharing their experiences, I would be more than happy to learn from you as well. It should be a two-way thing. But before I even start, I just want to say congratulations to all of the Saudi colleagues who are listening or watching. We are so overjoyed with this thrilling victory. And I'm not a football fan, but my screen, my Twitter, my Facebook, everything is just about Saudi victory. So please keep it up. And we look forward to
Thank you so much. We are excited.
Yeah, we all are very excited. It's good to see. So I'm talking about e-portfolios specifically in health professions education. And again, if I'm going fast or you do not understand anything, if I got frozen, please do raise your hand and let Shazia know. I can see you still here while my screen is going on, but by all means, I'm available to talk.
Yeah, we can see your screen. Yes, you can continue.
So I'm sharing my experiences of e-portfolios. The three major areas where I worked are one, longitudinal e-portfolio for the medical students at University of Western Australia, which I was leading, and we started it in 2014. And it has gone through multiple iterations after that, but it is still going on. Then I also launched e-portfolio for my HP students who were doing masters with me. And one thing I learned during my journey in medical education, you need to give a nice name to the things that you do. So I call this e-portfolio as SPACE, Structured Portfolio Assessment in Competence-Based Education. And then the one that I'm currently doing is for undergraduate medical students at Win University, and we call it WinMedFolio. So these are the major three ones that I was personally involved right from the planning and implementation. First of all, what is an e-portfolio? Simple definition, it is a collection of digital artifacts. So whatever you were using for your portfolio, if you are using now them in digital form, this is e-portfolio. Or the second definition that came in 2006 was where data containing text, images, audio, and videos are stored and can be retrieved. Very simple, but then you will see how e-portfolio has evolved during last few years. The third one came communicating both learning and professional experience. So it is no more just learning. It's also about your professional journey, how you have developed over the course of the time. And the last one that I particularly liked, and I think it's very comprehensive, is about a system that allows capabilities, events, learning plans, or any other event which is personally or professionally significantly linked with your reflection. I think this has actually included everything that you can include in e-portfolio. And those who do not know what PebblePad is, PebblePad is a portfolio management system, just like Canvas and Moodle, which are used for learning management. We also have few systems which are specifically for e-portfolios. So PebblePad is the one which started from UK. It then spread to, in Australia, again, we were the first ones to use it in 2014 in Western Australia. And now I think many universities in Australia are using it. So you want to introduce an e-portfolio. Can you raise your hands? How many of you are joining today because you want to introduce a portfolio? 1, 2, oh my God. Yep. People are raising. Okay, good. Thank you. Oh, good. I hope I'm able to give you some insights. Yes, thank you. The first thing that you need to know when you want to introduce the e-portfolio is why you are using it. Is it university directive? It is your personal choice, or it is really pedagogically aligned to your curriculum? Sometimes I see people who just want to use e-portfolio because it is the new buzzword. We should do that.
Yeah? I can see a few hands, they are raised. Dr. Zari, probably they want to say something maybe. So if we can ask, yes.
Yeah.
Akila.
Yeah. I think
you want to comment something?
If you want, Akila, do you want to say? I can see, but I thought they were raising hands because I asked them.
All right. If they want any comment, they can. Otherwise, you can continue, Dr. Zari.
If you can lower your hand, then Shazia can moderate. So there are 3 reasons where you can see. The first one was something which actually was based on all 3 of these. So we designed a new curriculum where we say the doctors that we will produce will be professional, leader, educator, advocate, scholar. And again, there is no MCQ or written test that could actually tell me that a student is a leader at the time of graduation or an educator. So we thought that is the best tool for us. So it was pedagogically aligned to my curriculum. It was my personal choice as well, because I wanted to experiment with the e-portfolio, but this was the time. So we started the new curriculum in 2014, and in 2013, which was around July, August, university as a whole decided to launch e-portfolios for the students in all the courses. So that was the right time perhaps for us to incorporate that into. So that was it. Second one, which was space e-portfolio, I use it again because I thought my students can do better. I'm the one who was leading the course in assessment and evaluation. And I thought a portfolio will actually let me know more about my students achieving the outcomes. And it will also give them the chance to reflect upon what they have learned and how they can apply. The third one is, again, there is no university directive, but the reason is purely I want to see the longitudinal development of my students. And it is the thing that will be used. I think in 5 years time, when medical students will be going for further training, people will be asking them for the e-portfolio rather than just looking at their grades and things. So you need to know why you are using this. Once you have done that, then think about which model is best suited for your needs. So I will give you examples from 2 studies. The first one is using portfolio, and this study actually provided us with 4 types of models. But these models are mainly dependent on the structure of your e-portfolio. So the first one is the shopping trolley model, where you have got a repository and you just put everything inside that. We use this model for our medical program at UWA. So like I said, that the curriculum was around 6 themes. For each theme, I had a shopping trolley type thing where they can put all the artifacts, evidence in one, and then we will look at that. The second one is the toast rack model, where there is a compartment. And I'm using almost this now because my students have got different compartments in the undergraduate program. There is a skill log. Then there is again the model that we are using for our curriculum is CPR. I'm saying that we will make them the clinician, professional, and researcher. So they are collecting artifacts in each of the compartment. Then the third one is the spinal column, where you have got competency based. And for each competency, you can identify the experiences that students may like to collect for their e-portfolio. The final one is the cake mix model, where you have got outcomes, you have got their independent learning and whatever they have gone through the clinical practice and the thing. And there is a common element of reflection. So structure-wise, you can see which model will suit your needs best. I'm not going too fast. Stop me if I go too fast. But this presentation will be available to you through Shazia. So if you want to go through just the slides, by all means, you can. So the second model is more about the content. Again, there are 4 ways where you can organize the content of your curriculum. So the first one is just a content. It's all there. And a good example for that will be like procedures log. It is more to me a logbook than actually an e-portfolio, because all you are seeing is whether the things are there, and that's it. But in the second model, you ask each artifact should be presented with a reflection. Third one, you also look at the content, you also go through the reflection, but you are also asking them how all these artifacts are connected to each other. So it is not that, let's say, I'm an educator. So I'm giving one workshop today on e-portfolio, tomorrow I'm doing something else. And I just keep on writing a reflection, I did this. You also want to see what is the connection, Zareen. When I come for, let's say, an appraisal, you will say, yep, you have done 10 workshops on e-portfolio, but how they all connect each other. Were you able to do a community of practice? Were you able to do something more? What did you learn out of that? So it's the connection between all those activities. And finally, the last one, where there is content, where there is a reflection attached to the artifact, you also look at the connections between them, but then you say, so what? How can you justify whether you have become a good doctor or not? So bringing it all together. And this one was very good experience with the medical program at UWA, because I could see students progress through 4-year curriculum, and in year 5, actually, then when they look back, what they started with in year 1 and how they have progressed through, they were the ones who were actually identifying how far they have come and what a transition that has been for them. So you have decided why you want to do it. You have also seen which model you want to use it. The third step comes, what type of activities will you include in your curriculum for the e-portfolio? So you can have some prescribed ones, which you say every student has to do. Or you can say, I will leave this e-portfolio choice for the students, whatever they want to include in that. Or you can have a mix. So prescribed one is very, again, it's like one size, which does not fit everyone. For the e-portfolio, for the assessment and evaluation course, I did not prescribe anything. I let students choose what they want to show to me. For the medical course, we use mixed. So we had some activities which were prescribed, but we also let students choose what they want to do. And this one actually became a nightmare in our first year, because the students were like me, they just want to finish off. So they were coming with a number of activities and we were going crazy how we actually standardize those activities. So I will come back to that with some examples. This is one most crucial thing that I learned from my experience, that you need to facilitate what exactly is authentic artifact. So again, because we had one of the themes called educator in our MD curriculum, students were like coming, oh, I did this one workshop for high school, I went and did this, and it was not making sense. Who is going to supervise those activities? And the same thing happened to me a couple of weeks earlier, when a group of students came to me and they say they are doing a workshop for the high school kids on sexual health. And these are like my first year undergrad students. And I say, but who is actually deciding the content? And then they thought it was something very simple. They can just copy the images of the reproductive organs and they will inform students about that. But when I sat with them and I say, what exactly you are going to do? And then also comes the issue of the consent and the things. So this artifact, which will happen now, perhaps in 6 months' time, will become a very authentic artifact for them with a number of skills that they will develop. So these are some of the examples from student selected activity in the MD course. So when we gave students the option to select what they want to include, I used to get all these queries. the funniest one was that I have donated the blood, so how I can include that in my e-portfolio. One of the students was a volunteer at the orientation camp, and that camp went for 2 days. So the student wrote in his volunteering log that from the time when he left home to go to that area, which was about took him more than 8 hours. Then what did you do for students to sleep? Excuse me. Andalip, do you want to ask a question now? I just saw Andalip.
Yeah, hi. Yeah, but you can, Assalamu alaikum. You can finish what you are talking about, and then the question can wait, but it is related, yes.
Okay, thank you. So what we did initially, that we set a committee immediately, because that was, I had 250 students to start with. And if I keep on receiving these requests, it was like beyond my means to approve them. So we set a committee, and that was the time when we started to standardize the activity. So if a student is doing some volunteering, what will be acceptable? What will not be acceptable? Many of the students who come to postgraduate medical program, they also have got a master's. Some of them have got a PhD, and they are also supervisors for the research project. So how do we standardize that? The third most common was that a publication. So how do we give points for a publication in a portfolio? So it took us a lot of time. So we started in 2014, and I think it took us about fair amount of almost 12 months to see what we are getting out of it. And it was purely because I told you that 6 months before that university decided to introduce e-portfolio, we did not have time to be trained ourselves in using that e-portfolio. It was more of a trial and error thing for us. So my advice for everyone who wants to introduce is do a pilot study first, because that will clarify so many issues which you may have not foreseen. The funniest one, that was that I am going to a ball at the end of the year. Can I get some marks for that? And I say, there are no points for that. And the student immediately wrote back, I know, I was just trying if there can be. And there was another one where somebody went for a dinner and they sat next to the Prime Minister of Australia. And the student said, can I get points for that? And I said, what will you do? The response was, I did discuss about the advocacy of students with the Prime Minister. So I think I deserve some credit. I said, there's no credit for that. You can also think of group e-portfolio in the beginning, and rather than individual. So this is an example again from a group e-portfolio, where students group has got all the learning outcomes of the course. We are delivering the sessions, but it is up to them how they actually compile everything and show us that they have achieved the evidence. This one was also a very successful initiative. And this is my first group who actually started it, and they actually selected the name Assessment Zone. Again, this is available online if anybody wants to see. Assessment, don't forget about it. So if you are using e-portfolio, how you are going to assess it? If it is just formative, students will not pay attention to that. If it is summative, you have to identify how it will be assessed longitudinally. What will be your assessment timeline? That is very crucial for me, because let's say I do not know how you work. So once the exams are over, the results are received, I take those results to the Board of Examiners to approve. There's usually a 2 weeks gap between the last examination, collating all the scores and the board of examiners. But if I've got 250 portfolios to be marked, it was a terrifying job to do within 2 weeks. You can't be ready for board of examiners. So be very clear what will be your timeline. So I usually have this submission 4 weeks before the exams actually start. So that gives me enough time to go through the portfolios and see how we can actually take them to the board of examiners. You also have to think that a student may have passed everything, but they are failing on portfolio because they have not submitted an artifact. So because I had ample time, and if there's something which is not correct, or by an error, a student has uploaded a different file, it was enough for me to go back to the student and say, hey, I need this to be completed before I take it to board of examiners. Again, progression rules. What will I do if one person has not submitted a portfolio, but that person has passed everything? So it is very important for you to document what will happen. For written knowledge-based exams, for OSCEs, you can have a sub. You can ask them to come. But portfolio is a collection of artifacts over the course of the year. What sort of remediation you will offer them? So the way we did it, let's say even after my reminders, a student has not submitted. At the board of examiners, I'm taking the file and say this student has not submitted, the student needs to be failed. The student will get a sub, but that sub is actually an extension of the submission deadline. So we will have a sub usually after 4 weeks. So student have time now for 4 weeks to do it, but it will be recorded as a sub or in second attempt in some countries. If a student still does not do it, then the student will fail. That is the most difficult decision to make because the student is coming to repeat the whole year. So far, it has happened only once, where a student was given 2 options but did not comply. But then we found out that the student does not want to become a doctor anymore. He has some other interest, so he actually withdrew from the course. Board of examiners date is important, and I've already touched on remediation. These are some very important decisions for you to make. Similarly, portfolio, if it is longitudinal, it is not linked to a particular course, how it will be recorded on their transcript is important for you to decide. So we had a separate component. It's a requirement to pass, let's say, year 1, that a portfolio will be submitted. So it is recorded as a separate element. You can have any portfolio just for your clinical rotations. But again, if you are assessing them after every rotations, it's huge workload. I also have got a dedicated group of portfolio assessors. So initially, when we started for the first time, it was a big pool of faculty members. For 250 students, I think I had more than 30 people to mark the e-portfolios, and it was not just the marking, it was also to discuss in person with the students. It was not sustainable. I could not do it every semester or even at the end of 1 year. So my savior was to have a dedicated pool of portfolio reviewers who were trained. So we had a standardization of what each artifact means to us. And the good part of that was because this group continued from year 1 till year 4, till they graduate. And they were marking the same group of students. They were the ones who told me that they can see a difference in the students' development. Otherwise, for somebody who comes just for 1 semester, look at the portfolio at that time, they will not be able to recognize that development. So I learned something valuable on the way. Our portfolio model at UWA was a mix of formative and summative. So the first semester was formative, but after that it was summative throughout. Formative give us again a chance to see that our students are familiar with the platform, our faculty is familiar to access the portfolios and take it further. If you want students to use ePortfolio, I will suggest you create your own first. That will give you some insights which I think you will not get if you just jump into students. But when you create your own, you actually identify how much time it will take, what thought processes will be involved. So if you have not done your own ePortfolio, please do yours first. And again, for the faculty, also it is become like a requirement now. So many new jobs that you will see in academia being advertised, they ask you to submit an ePortfolio. Assure the support from your faculty and university. Once you are ready to implement portfolio, you need a very good platform. There are platforms which are available free. There are ones which are commercially available. Mahara is one, Canvas is another one, and PebblePeg. But there are many, many more. You can also develop something in-house. I am always against developing something in-house because it takes a lot of efforts. And if the person, the champions who were behind that move out of your institution, it is very difficult to carry. For cost effectiveness, the commercially prepared programs are much better to use. There is an investment, but in the long run, it saves you a lot of time and energy. You can also use free like Wix and WordPress. The problem is if you are using it for high-stake assessment, summative assessment, it's not the ideal thing because you need to control what is the content. And once you are at the point of the assessment, you do not want the students to change anything after that. So commercially available programs have got that facility that at a certain time when you want the students to submit the ePortfolio, it will capture that snapshot. Even if students make changes afterwards, it will not apply to that submission. So please go for that. Support, human, you need human resources. If you have 10 students, you can manage it. But if you have got a group of students, even larger than 50 or plus, you need more than one person. You also need financial commitment from university. So even like I've got 250 students, now I've got 50 students in each class, but I need a commitment in terms of somebody as an academic assistant, somebody to review them, and for some minor tasks, training. If you do not have a good IT department, you need somebody within your medical school who is e-learning expert. Again, when I go back to the example that I started the first ePortfolio without any training and without any experience, the problem that I was facing, that a student will come to me asking for something about the ePortfolio system. I will write to someone else because I also don't know. By the time that feedback will come, because we were using PebblePeg and there was a time difference. So by the time that feedback will come and I will try to understand, my student is waiting. So be very sure that you have got enough support and you also have got a financial commitment. So if you are using a commercially available program, your university needs to make that commitment. Otherwise, what happens if after 1 year or 2 years, university said, now let's go for another one, which is more economical. everything has to be transitioned. You have to learn the new system right from the beginning. So that commitment is very important. And it happened with me recently. We are using Canvas, and Canvas has apparently got 2 different types of e-portfolio. So I started with a very basic one, and everything was going fine. And then comes the submission time. And I received an email from the student, Dr. Zareen, Professor, my e-portfolio has disappeared. And I didn't know what happened. All I knew was that somebody at the university IT department has decided to go for the second option without letting us know. So the students who have been working on the e-portfolio for last 18 months, they suddenly lost the access. And nobody in the IT department knew that Zareen is using that system. But it was again at such a short notice and I didn't know what to do. I immediately say, e-portfolio is not required to be submitted till I sort it out. It was sorted within 1 week because all they have to do is just make that functionality available again. But I didn't want my students to be stressed at that time when they are going for their final exams. Protected time, very important. I also see that we create activities for the students, but we should not assume that our students will be working on e-portfolios after 5:30, like you people are attending to my talk. We should give them some protected time. Students need to make sure that they have got enough life and study balance. But if we keep on creating activities which they cannot do during their 9 to 5, it is tough for them. And again, I say, do run the pilot first. Don't jump. This is an important issue for you to consider, how you will archive the e-portfolios. Who will manage that? Who will take the backup of your e-portfolios? So please discuss it in house. Digital ethics, you need to be very clear with the students what can be included in the e-portfolio and what cannot be included. Will you allow patients' images to be used? Perhaps not. So, and that is why I am against the commercial, against the freeware available, because if a student put something there, you may not know. But when it is a commercially designed program that is especially done for your institution, it is much easier for you to moderate. Remember, anything which goes into e-portfolio, my belief is that even if you delete, it is somewhere stored. So your digital ethics will play a very important role. A lot of work is currently being done in this space, and I think we need to do more. We need to keep on reinforcing it again and again. I understand that many of you are actually medical educators who are listening to me. So my important advice will be to take your faculty on board. Faculty engagement is very important. It happens when faculty will tell your student that e-portfolio is just a waste of time. They need to understand, and this is the faculty which is perhaps in the clinical space in the hospitals, who were not engaged when you make the decision to incorporate e-portfolio. Events, arrange events for them. Maybe also let them have an opportunity to create assignments for the students, which can be included in your e-portfolio. That is a very successful initiative if your faculty is on board, and you need to provide them with the resources, with the training, and just for them to get to know why portfolio is important and what is it doing to the students to prepare them for the future. Showcase. Students do so much work. It needs to be shown to the world. So arrange the showcase. We also did the Dean's commendation. So what happens, because I had portfolios assessed over course 5 times during their course with us. So a student who always receive excellent in perhaps 3 points, the dean, I will get them a letter from the dean saying that they've done an exceptional job in the themes that we have defined for the curriculum. This is important for them because it counts towards their internship application. So I will always make sure that the final dean's commendation goes to them before the applications for the internships are due. You can also give them the prizes. I was very lucky to have a family who had a bequest and they want to give a prize to doctor who is a holistic doctor, and they came to us and they say they want to have a prize. And it is very difficult for you to find out who among your class is the best one to get a prize, who is a holistic doctor. I was very, again, in that position where I could motivate them to offer 3 prizes rather than 1. So they gave us the amount, but we divided that amount among 3 students. So top 3 students who have achieved excellent commendations over the course of years will get that prize. Then you can also showcase them on the digital platforms, and after COVID, I think we are more comfortable using the digital platform. So you can create a web page within your university website where they can showcase. I think it is also very good branding for your medical program. Okay, I've been talking about from the faculty perspective, but let's say what students think. Students hate e-portfolios most of the time. But this is an email that I got from the student after graduation. And when we started in 2014, I can tell you there was so much resistance from the students. But once they graduate, then they realize how important it was. And then these students say, whatever our curriculum that we designed around the 6 themes, now the postgraduate training is also using similar themes. So it was very good for this student to get a position in one of the training places after internship. I also ask students to create a digital story at the end of their course. There is one which was done by this student. She used the jigsaw puzzles to tell us how all of this connected by the time she graduated. Another student again. Students are students, whether they are postgraduate or undergraduate, they need to see the connection. Sometimes they do not see the connection in the beginning, and I think we also have a role to play in that. I'm aware that Australian Medical Council is now preparing a framework for medical internship, and they are also looking at e-portfolios during the internship so they can keep a track. And again, it is important if you are asking students to do something at the undergraduate level, how useful it is for them within your country. This is another one, the final reflection from my student, I think, where I would like to end. I love using metaphors, and I'm always amazed how students can explain their feelings using the metaphors. One other thing that happened during my involvement with ePortfolio is a community of practice that I was part of. And if you do not have one, let's start one. We were able to write an article for others based on our experiences. So this article is available to you. I would also like to thank all the students whose work I have shown, and great support from both the students and faculty at some stage is important for your own survival, I think. So I think I've done enough. It's time for you to ask questions. Thank you.
Yeah, thank you so much. Thank you so much, Dr. Zareen, for this wonderful presentation. And I would say that very much inspirational reflection on your experience of using ePortfolio. That's amazing. So I can see there are a few questions in chat box. Apart from that, I will invite questions from participants. You can raise your hand and can ask. There is question. Yes, Dr. Andali, I would prefer if you can unmute and can ask your question. Is that okay for you?
And I will then go through these questions.
Yeah, no, I've posted my question there on the chat box, but it was a very nice presentation. Yeah, my first was what was the software, but you told them you have given the name of the software, so that is fine. But then the other question is there on the chat.
What's that? I'm just going through the questions.
Yeah. So did you identify from the onset, from the very beginning, a list of competencies that were primarily submitted to and will be assessed via your ePortfolio, so that students would know from the very beginning that these are to be covered in 5 years, and then the importance comes in.
Yeah, we did it. So like I say, we had 6 themes. So for the professional leader, again, I would like to share with you that initially when we started, we were of the view that we will give students the leverage to come up with their own activities. So we had identified the learning outcomes and the activities next to that. But then we found out that the students were not doing those activities. They were coming up with their own activities. So when we had the second iteration, we actually restrict the number of the activities that students can propose, because there were some important activities which we thought students will take up, which were not done. So that happened with us.
Thank you. There is one, I hope that answered to your question, Dr. Andali. There is one question by Dr. Sana, that what is the best way of implementing an ePortfolio for assessment of professionalism?
Okay. For the professionalism, we start actually with as a prescribed activity for them to read the policy, the professionalism code of conduct that the university has. That was it. Then what they did write. So for the current course, I'm giving them an option of creating their own artifacts for the professionalism. So in the first cohort, we gave them, each one of them got an attribute that's part of professionalism, and they have to demonstrate their understanding of that and then come together and discuss. We also have got some cases where they have to respond, and at the end they have to submit a reflection. So professionalism is very good. Every clinical rotation has got a professionalism assessment, and that was also part of their ePortfolios to add that to us. So I think professionalism is the best one to start with, because you can't really have a knowledge-based exam. You can do it in OSPI, but to see their development, and if you have got a mentoring program, I think they both go together very well.
Yeah. Thank you. There is one question by Dr. Yusra. As you mentioned, different aspects of faculty. So how to assess faculty performance on ePortfolio?
Again, it has to come from your institutions. What is their expectations? Usually there are 3 areas. What are their research, their teaching, and their service. So if you have identified the 3 areas and exactly what you need in those areas at the level of the faculty. So for example, I give the example that I always use is to get the good feedback from the students. Some people say on a scale of 1 to 5, your feedback should be 4%, or there should be an 80% agreement. For somebody who is just starting their career as a lecturer, I think that is not the right expectation. Similarly, for somebody who is at the level of professor, I think that is also not the right expectation, because they should be doing something more than just getting the feedback. So it depends on you as an institution. What is the level of performance that you want from the faculty at each stage of their appointment? And then you can easily assess that in the portfolio. But please feel free to ask if I'm not responding to you, or your question means something else.
I think that's clear. There is one question by Dr. Abdul Rahim. Very interesting, and that's, I think, my question as well, that how we can differentiate between logbook and e-portfolio, because it's very important for faculty member to clarify, because many think that logbook is the form of e-portfolio. So he has put up the question that, can I use e-portfolio instead of using logbook to assess student performance? Is it the same thing?
It's not. Logbook is just a logbook where you're just keeping a log. So you can, I will be using logbook as one section of the e-portfolio. So what I have done, I've listed all the procedures that students have to do, and they have to submit the evidence, and I will be assessing at each point, perhaps at the end of year 4, at the end of year 5 and year 6, to see what procedures have been done competently by the students. But if this is not just it's not an e-portfolio unless you also add something more to that. You ask them to submit a reflection. What is your learning plan? You have done, let's say, give me some examples. Think of mental state examination. So if you are looking at the log of mental state examination and you are always seeing that it is just for the depression, all the mental status examination histories are from the depression, you can make a point. Can you go now for these particular areas? Excuse me. A mental state examination for a schizophrenic will be very different. Similarly, you can also keep a log of the patients. So again, students can submit the patient presentations, but what did they learn out of that? So if you know that Kolb's learning cycle, that's very important. What did you learn out of that event that happened is important. So if you add something more to the logbook, I think that is again a very good starting point. Any other question?
Yeah. And in continuity of the same, when we mark this e-portfolio for assessor, what about subjectivity? And is this enough to use some rubric? Are we using some kind of rubric to assess e-portfolio?
We did. So when the faculty was designing activities for each of the curriculum domain, we also have a meeting with the group of the people who will review what are we actually looking in that artifact. What will make it good, what will not make it good, what exact information we are using. So again, if you look at the assessment of the reflections, it will provide you with some of the very nice rubrics which you can modify according to your thing. We do not give a mark score to the e-portfolios. It was just pass with excellence or just pass at the average level. So because I had some students who did bare minimum, but some of the students were doing exceptionally well. And we were, and if you have got time, I would like to give you an example, 2 examples as actually. Yeah. Have you got enough time?
Yeah, and we have 10 minutes.
So we have got one of the themes, advocacy. And for advocacy, you can give them a lecture, you can give them something to watch. But students were actually supposed to be part of an advocacy and then show us the evidence. I had one student who came to me, and this student actually was in the psychiatry rotation, and he used to see one patient who was always lying in the bed staring at the roof. And the student says, if this is patient can get a television, perhaps he might make some change. He's always staring at the roof. So he asked the hospital, can we provide a television in the room? The hospital responded that there is a cost to that. So if you want the TV in the room, the patient has to pay. The patient does not have the money to pay. So that makes the student to advocate on the patient's behalf. And this patient was from our indigenous population. The student found out, which none of us knew, that they do not have to pay by law if they are in the hospital. But none of us knew. My head of the department, who is emergency medicine professor, did not know about it, but it was written and he did arrange that. I had another student who also used to see that we will always complain. There was a particular public hospital. Around that area, people are always sitting and there is more criminal activity there. And that was again one segment of the population which was like being targeted, that it is because of these people. The student found out that again in the hospital setting, and again I can relate to it. If you are in a room and you are not used to confined spaces because you live in an area where you have got all the open spaces, so these patients will leave the hospital the moment they get an opportunity. They do not wait to be discharged. They just can't leave. And although the government provides us the facility that from the rural area to bring these patients to the hospital, if they leave against the medical advice, there is no way to take them back. So what will they do? They have got no money to go back. They will just settle around that hospital. They have no money. They want to get money. So the criminal activity was perhaps happening because of that. All we need to do is that if a patient does not want to be treated in the hospital, they want to go back, they should be allowed to go back with the same respect that they were brought. So that was another example for advocacy. And these are like medical students doing. So
Yeah.
I would like to mention this third one as well. This girl was from a background which was not very privileged. And because our students go to the rural areas, we have a program where they go for 1 year. One night when she was on the duty, she attended to 2 of her school class fellows. One has unintended pregnancy. One was unconscious because of the drug overdose. Her reflection was, I think, more powerful for me to read because she could see how education has made a difference to her life compared to the 2 young kids that she was with at the school who are not there. And she also could compare what empathy she could bring to them compared to an international medical graduate who has just come there doing nothing and making comments about these patients. So those reflections are very powerful.
Yeah. Thank you so much for this very much practical examples. There is a comment by Dr. Anil that, ma'am, you are requested to kindly share some examples from your own e-portfolio, and this will be useful. Definitely, we would like to know that which portal you are using for developing your own e-portfolio, or what you will advise us. What's the best one if we want to develop our?
I use Wix for my own e-portfolio, where I've divided it into my education, my publication, and my service. So even if you search my name, I think you can get it, zareensiddiqui.com. It has not been updated because I'm the lazy, and that's why I want you to experience that. How often can you update? So you can use that. Otherwise, even if you are using LinkedIn or Sid, you can create your e-portfolios there. It's very easy. But if you want to make it really nice, I will suggest Wix.com has got nice templates. You can buy that for a very small amount of money. But if your university provides you with something better, go for it. And the good thing about commercially prepaid management system is that even if you leave the university or thing, with a small subscription, you can take it with you.
That's it. There is one comment by Dr. Anil Kapoor that what are the activities like for the beginner, like most institution at undergrad level in Saudi Arabia, we are not using e-portfolio for undergrad students. So same, he said that what are the activities you would recommend to be documented in e-portfolio for the beginners as a faculty and for students as well for undergrads?
It depends what you want to do. So I gave you another example from a course that I was teaching on the leadership. So I asked them, the first reflection for them is about what is their leadership experience? What are the skills that they have got? Then I gave them a survey on identifying their leadership style. And then I give them the results, so they do it. And then they take on some examples for a small scale for leadership. So that's one. For the reflection for my current course, I use a digital video clip just to introduce them to reflection, because if you are using reflection in a portfolio, you need to train them. What is reflection? How you can reflect? So I just use a 2 minutes video. They reflect on that, but I think I can see other comments about reflections, but I don't think we have got time.
So there is one comment by Dr. Sevian that most people are not much aware about e-portfolio softwares which are available. However, still that's why they have questioned that when in the provision of e-portfolio software for faculty to give written feedback, is there any slot or space in e-portfolio where you can give feedback, you can write feedback?
Yeah, PebblePad has got that option, and I think everyone. So when I look at the portfolio, I actually provide them the feedback at the same time. So I can do that. Students can respond to that feedback, and it's very easy to manage. Have a look at this. Do we have anybody in the audience who is using ePortfolio? Because I've experienced with PebblePad and I've experienced the Blackboard and the Canvas. I favor PebblePad because PebblePad has been designed specifically for health professions.
All right. So is it free available if anyone want to subscribe and join?
None of the commercial ones are available free.
All right. So you have to purchase.
Are you using any learning management system at your university?
Moodle.
I don't think Moodle has got a portfolio option, but Canvas, Blackboard definitely have got one.
All right. I think most of the questions have been answered. If any participants, they want to reflect on their experience of using ePortfolio, feel free to unmute and you can discuss. There are a lot of thanks for this presentation, and we shall appreciate if you can share your presentation. That would be really great. So I have last question from my side, that as you mentioned that ePortfolio is like for summative reasons, you mentioned that if then students can adopt and faculty can also get training if it is must. But why not to start initially with formative, where students, they don't have apprehension that I will lose my score, it's just for their learning. So what's your opinion on that, that why not to start as a formative rather than summative?
Go for it. If you can motivate, I think the student motivation is less.
Okay.
Because again, we have got so much to learn in the medical school. And if it is formative, students will keep it till like the deadline. So it is good for the first time. If you are launching first time, so they are familiar with the surroundings of the management system. But my experience has been like that. Formative, say, okay, what we would, it's okay, we'll do it. One day we will do it. But the students are so high, so many of them are high achievers. They will more focus on the thing. Even at Win University, where I'm now using, it is summative, but it is only pass-fail.
Okay.
So students keep it unless so what I will do when I've got an activity, I will ask them to add it into the portfolio at that time and submit it.
All right. So as you mentioned that in curriculum, students, they are asked to fill their e-portfolio throughout the curriculum, starting from year 1 till year 5 or 6. So how about the idea that why not to use in the last 2 years when students are more mature and they have better reflection on their experience? So can we use it in that years, or is this compulsory?
Why not? Why not? It
All
depends.
right.
Some people use it within just their course. It's a course portfolio. It's not a longitudinal.
All right.
Yeah,
All
it's up to-
right.
When I was teaching MHP course on assessment, it was just specific for that course. Nobody else was using.
All
But
right. So we can use within the courses as well.
I can see, but then one of my students wrote back to me that based on that portfolio, she got a job as a lecturer in assessment because she could show them that portfolio that she has done all of these things.
Yeah, yeah. So it is a good benefit for employability as well. You can
Yeah.
show your oral record. So I think we have taken up all questions. Lot of thanks for this wonderful presentation. And Dr. Zari, so much thank you for your time, especially when we are taking your time at midnight. Thank you so much.
Past 1 a.m.
Oh yeah, I highly appreciate, and you look as
My
active as
pleasure.
it's daytime. Thank you so much. I'll share recording with all of participants and with you as well. And thank you so much. Hope to see you in Saudi Arabia soon.
I will send you the presentation. So if anybody wants it, by all means, they can.
Sure, sure. Thank you so much.
Bye.
Have
Khuda Hafiz.
good night. Bye-bye.